if you're listening to this, the most likely reason you're going to die is because of cardiovascular disease. And that's not hyperbole. Those are just the facts. Unfortunately, cardiovascular disease is the number one killer. So anything that we can do to prevent heart disease, reverse heart disease, extend your health span and your lifespan using integrative, natural, and holistic approaches is something that I personally love to explore. And today we're going to be exploring that with Dr. Bharat Sangani. He's a medical doctor who is steeped in the world of integrative and holistic medicine. He was trained conventionally, and yet he preaches and teaches and works with patients on holistic approaches. And today we're going to be talking about those approaches, his philosophy, and how he guides patients to developing holistic habits to protect their heart health. Thank you so much for being here.
It's all pleasure.
So you're a conventionally trained medical doctor. You're in Texas. Your practice in Texas. We were talking before I hit record. How did you go? It's pretty rare to find a conventionally trained cardiologist who is then transitioning and implementing more integrative approaches. How did that sort of path come to you?
That's a very good question. But if you look at my background, then I was born in India and came with all the Eastern culture. And I've been here for decades and I've imbibed the Western culture. And I've picked the best of both and created my own culture. And had a great lifestyle that is going on since then. And same thing I did in medicine. I was trained conventionally. I still practice medicine. I still practice conventional medicine. I fully believe in it because it has its own good things. At the same time, on the holistic side, there are a bunch of other good things that this side misses, and this side misses this side. So I'm just very fortunate to be able to peek into both sides and pick and choose what I want and create my own way of telling my patients what is best for them only and only after I practice the same thing what I preach them.
I love that. And so often, you've got doctors who practice conventionally, you have doctors who practice integrative medicine, naturopathic medicine, functional medicine, whatever word, is it's going by these days. But rarely do you have that combined in one individual. Oftentimes, there's this information is siloed. They're in silos, and patients aren't, and doctors oftentimes aren't communicating with each other. It's not typically a team environment. There are clinics that do have practitioners from multiple backgrounds on staff, and they can share notes and have more of that. But that's pretty rare. And it's even rarer, I think, to have your expertise and knowledge and history in one person. So, frankly, your patients, I think, are really fortunate to have you. But when you,
That's nice of you to say that. And you are very correct. You are very correct that very few people have this opportunity to be able, but all it takes, Dr. Newstart, as we have discussed before, you have to have an open mind. Because I was trained conventional medicine, if I had closed my mind to any other areas, I would have never been willing to accept that other choices do exist. But because I kept an open mind, it has all come to fruition. It has all come to a product that I'm very proud of.
and I think people here in the West are very familiar with the conventional Western approach because that's what we all grow up with. How did your background in India, the way you were raised, what you're exposed to, what you experienced, what from that have you found to be most valuable in terms of bringing it and combining it in your unique way into your approach of combining these different, I don't even know, philosophies of medicine?
No, that's a very good question. And again, if you go back to India, and you are most proper person to talk about. India was brought up on naturopathic medicine. It's all natural. There are so many institutions. They practice naturopathy all around. And the other way, just by being born in India, what we have learned is how to deal with stress. The with 1.4 billion people, people crossing over everywhere. Life doesn't have the same support as the government of United States supports with Social Security, this, that. None of those things truly exist in the right nature in India. You're on your own. Stress becomes part of life, and you learn how to live with stress. So, getting exposed to the naturopathy medicine from day one, you have heard about Ayurveda, you have heard about all those things, all these factors of medicine apparently were originated from India. So I would be stupid if I would not pay attention to what has worked there for thousands and thousands of years and just go after what conventional medicine does. And India embraces conventional medicine too. So that's how I could combine all of these things together and had an open mind.
And so when we're talking about, habits to protect people's heart health, what are some of your, how do you talk to patients about that, and what are some of your top ways to help them move in that direction of developing those healthy habits?
Again, I am not the guy who will say you got to follow 10,000 rules because that doesn't work. You have to narrow down what is the most important rule or rules, very few. Those are essentially needed, which will cover 90% of the things. And that is true in investment, that is true in health, it is true everywhere. If you try to follow all the rules, it's just never going to work. Life is not worth living when you are only living by rules and nothing else, right? You need to have fun too. So I strongly believe that living should be simultaneous. But the first and the first most important of everything, if I have to sort out, two things I tell patients that if you don't do anything else, I would like you to do other things too. But if you don't do anything else and you just tell me that I will only do two things, doc, what would you recommend? I would say maintain ideal body weight, and second, stay away from tobacco.
Hmm.
These are the two most important things you can do it for your heart. Now, if you allow me to expand my role a little bit more, and you say, okay, give me a few more items after this,
Yeah, yeah.
yeah, then I would say, okay, ideal blood pressure, ideal cholesterol or the lipids, whatever you want to say, and type A personality management, because stress is very important in heart disease development. So if you put these five things together, I think you pretty much got a mastery on heart disease.
And as you're talking those, you're going down the list, I'm thinking about, you know, almost for everything that you mentioned, a medication came to mind. Okay, well, we can lower blood pressure with diuretic or an ACE inhibitor. Obviously, GLP-1s for body weight, and then there's statins for cholesterol. But I'm assuming that that's not your ideal first line, if unless it's absolutely necessary.
It should never be first line for anybody. It's not only mine. First, let's use nature to help us. If nature says, hey, maintain ideal body weight and I'll manage your blood pressure, why do you want to take medicines? I do not know of any medicine that has zero side effects. I mean, I do not know one. So, why do I want to go that route if I can just use nature to help me? Meditation, if it helps my stress level, understanding life, and following the most important rules of managing life stress, you won't have to take all those medicines to calm down. You don't have to take anti-anxiety medicine. So I'm just like what you just said. I'm not opposed to using those medicines because sometimes, even after you maintain ideal body weight, if you came with different kind of genes, it may not manage your blood pressure. It may not manage your lipids. It may not manage your heart disease. Then you obviously will have to take medicine, and that's okay. But let us put our efforts first. Let us just not go to a doctor's office and expect the doctor to be a miracle man and say, give me some pill and I want to be brand new person when I walk out of this office. That's an unrealistic expectation.
I love that approach. I had patients, they used to come to me, and sometimes they would say, They wanted a prescription. They just wanted a pill. And I would send them away. I said, if that's what you want, I'm not the right doctor for you. There are plenty of doctors that would do that. So I love hearing this from you. I think it's serving your patients really, really well. And you mentioned 5 goals: blood pressure, ideal weight, cholesterol or lipids, and a couple of others. But what are the habits then?
Smoking, saying you're smoking, and stress management.
Smoking and stress. But so, what are the habits then that allow people to accomplish those goals?
The you have to first of all determine that I want to do that. At the end of the day, you have to take responsibility of your own health. Unless you take that responsibility in your head, none of these things are going to work. So the first habit you need to create in the morning, and in the United States, we have created a culture of entitlement. And once you create a culture of entitlement, you always blame somebody else for where you are and what your failures are. And that doesn't work in health management. In health management, for failure or success, you are the person who is responsible for it. It's so that every morning you wake up, you must think, I am responsible for my own health. So once you determine that, then everything becomes relatively easy going forward. And the first and the most foremost thing we need to manage, again, we are a country of abundance, right? I mean, that's why you mentioned I live in Texas and I work in Texas. And so Texas is everything is big here, right? And that is the tendency of us to think all across the nation. We won't love to eat buffets with endless plates. We want to keep eating and eating and eating. But if you take responsibility of your own health, you will say, enough is enough for today. I need to back off. So, and then the same thing about blood pressure. Salt is the enemy of blood pressure. But every every kind of food that we find in cans, synthesized foods, or the foods that we eat in restaurant are loaded with fat. So, I mean, forget fat, that's next.
Mm-hmm.
Loaded with salt. But you need to recognize that you can't keep eating salt and expect your blood pressure to stay under control. Same thing about fat. Everything that's tasty is loaded with fat. Now, I'm not saying don't do this. I'm saying do it in limitation. Maintain ideal body weight, and then you can indulge into all these things occasionally.
And so that's diet. What else is there then that you talk to patients about in terms of developing habits?
Immediately after that comes is addiction, especially tobacco. Now, we are now even glorifying marijuana. I mean, I don't know how that is going to end. If it looks like everybody is now saying it's okay to ingest marijuana. And again, I'm not against any of these things, but all I'm saying is, listen, tobacco under any size, shape, or form is damaging your body. Why indulge into it? Just stay away from it. You don't need that high by taking tobacco. There are various other ways you can still get the same place. Unfortunately, with tobacco, the dosage needs to be higher and higher to get the same kind of satisfaction that you need. So my second most important advice to the patients is to stay away from tobacco or any kind of addiction for that matter.
Okay. And with the tobacco, if they do have it, some people really struggle with addictions and getting rid of them, whether it's addiction to social media or addiction to tobacco, substance addiction to certain foods. Are there any, tips that you found or approaches you found to help people transition away from those things?
Absolutely. First of all, I'm not making light of it. There are two things in my mind are the most difficult things in the world for a human being to do. One is to lose weight, but now that equation is changing with GLP-1. And second is to quit smoking. So let's talk about quit smoking since you asked that question. The acknowledging the fact that is the most difficult thing to do. The best way to do that in my mind is not about willpower. I always believed When people say, oh, if you have willpower, you can quit smoking, you can quit eating, you got to a strong willpower. I don't think it's a willpower issue. I think it's an abundance issue, is an access issue. If you want to quit tobacco, just make sure A, there's no tobacco around you. B, you want to make sure you are nowhere close to tobacco. So both ways you need to be very cognizant about it. So don't buy cigarettes, don't buy tobacco, don't buy any of those things, and don't ever use your credit card or cash to spend the money. And wherever there is smoking or whosoever is using tobacco, just don't be there. So that's number one. And I think that will solve a lot of your issues right off the bat. And then after that, take help of medicine. There are so many other ways. You can get the chewing gums, you can get Nicorette, you can get all those things. Use that freely. There's no harm in doing that. And don't even forget that there are, not all of them are good, but there are some meditation courses which would also help you a great deal. Again, it probably falls in your ballpark where you practice medicine as to how to train mind to stay away from addiction. And those are the things I strongly recommend about tobacco.
But I think any of the habits that we develop in terms of training the mind has to do with rewiring the brain. I mean, our body has neural networks, and the more we do a certain activity or even think a certain thought, but the more in particular, we do a certain activity, the stronger those neural networks get, and the easier it is to continue to do that activity. So I totally agree with you that, with tobacco or any other substance that somebody's addicted to, isolating yourself from that substance is the surefire way to help avoid it. But I would also say, and I think you sort of hinted at this, avoid triggers that are going to stimulate those cravings. And for a lot of people for tobacco, it's alcohol, and also it reduces your inhibition. I think those are all great tips when it comes to habits and forming habits. As I'm sure a lot of it's just about repetition and overdoing it over and over time so that it becomes easier, like choosing healthy foods, choosing healthy habits. When it comes to diet and addiction, so those are two. What other habits are there that can help people reduce their cardiovascular disease risk in terms of getting to those goals that you've outlined before?
The next one on the list is the stress management. We are not paying enough attention, or we are not paying enough value, or not giving enough value how important the stress management is in heart health. Uh, is you and I both know, because we are coming from medical background, that anytime we get excited, whenever there is stress, a lot of adrenaline gets released in the body. And that adrenaline goes, just like any other organ in the heart, in the body, it also goes to the heart. And the moment it goes to the heart, there are centers in there which increases the heart rate, which increases the contractility, which increases blood pressure, which increases stress, increases the all of those things, which is generally not good for heart. So it's important that you manage stress very properly. And listen, you and I are, even though we have made huge amount of progress in our lifestyle, we haven't helped our brains a whole lot. Every time things have become faster, quicker, larger, and what does that do? That means you are supposed to react faster. You're supposed to react quicker. You're supposed to do things quicker. And that puts stress. And that doesn't give you enough time to relax. Think. My dad always used to tell me, son, don't forget to smell the roses in between. And I think we have forgotten that. I've forgotten most part, especially with social media. I mean, people are spending 5, 6, 7 hours a day on social media. They forget exercising. They forget relaxing. So I think one of the things we need to learn, and everybody does it differently. There's no one shot, one rule how you relax. But I think if you have to figure out how to manage your stress.
I love that. And with the cell phones now, with the vibration and the noise, the dings and bings that come up with texts and alerts, and it affects the nervous system.
Hugely. And then I'm not going to underplay what you mentioned, which is very important, and I didn't stress enough. And I want to take this opportunity to make sure that I concur with you, and I send this message out to everybody. Alcohol. Listen, my patients come and tell me all the time, say, Doc, I read this article says alcohol is good for the heart. And I say, you are probably correct. Alcohol is good for the heart. But let me explain to you what that means. It means that you can take 2 ounces of alcohol at the most every single day. And as long as you cross that 2 ounces, it needs to go to the next day. And you can't have an alcohol binge. You cannot continuously grab alcohol all the time. So I strongly emphasize what you just mentioned, that alcohol needs to be restricted. I'm not opposed to alcohol ingestion, although I never drink. I've never drank in my life, but I'm not opposed to it, but within limits.
It's similar with food as well, with specifically with ultra processed foods, and that's getting more and more attention these days. And the research, when you look at ultra processed foods, and 60-70% of ultra processed foods, or foods on the shelves, packaged foods, are ultra processed in the United States markets. That seems like there's pretty consistent evidence that consuming above 10% of calories from ultra processed foods increases the risk for cardiovascular disease, all cause mortality, obesity, diabetes, cancer, breast cancer, for example. They're not prostate cancer, which is interesting in the story, in the research, and many other diseases, frailty, etc. And so it's that threshold, and it's what you've said. It's not that somebody has to completely avoid it, all the time, but in moderation. And I think it's that in moderation that is a fuzzy concept that people take liberties with, and they define it based on their own desire of how much they want to be consuming, not necessarily what the research supports. So a lot of people with alcohol will, have a glass of wine a night, definitely more than the 2 ounces.
No, no, yeah. Listen, you again touched my nerve with ultra processed foods. I mean, we have now developed a society where it's so much easier and accepted convention to just consume ultra processed food all the time. Just give you a simple example, and this has also been proved. Go into any primary school and go from kindergarten to the first, I would just say go up to third standard, and show me how many kids do not have glasses. And when did that change? If you take a history 50 years back or 75 years back, you wouldn't find 99% or 90 plus percent of the student population at that age needing glasses. But we are here today. And a lot of that is because of the ultra processed foods, all the steroids, all the stuff that is coming through the food that you feed these young kids is affecting. It's affecting puberty. Puberty is getting earlier and earlier every decade. So all of those things are the end results of all these ultra processed foods.
Yeah, and so the bottom line in terms of healthy habits for your heart is choose whole foods. Eat a whole foods diet. There's research that was done decades ago, first by Caldwell Esselstyn, Dr. Esselstyn, and then by Dr. Dean Ornish, showing that through diet, and Ornish's diet was a combination of diet and stress reduction, atherosclerosis can actually be reversed. And I would love your take on that in terms of, what you think of the role in diet, both in prevention, but also in treatment if somebody has heart disease already.
So prevention, 10 out of 10. There is no question in my mind that if you control your diet, you stay away from high cholesterol, high fatty stuff, and you manage your lipid profile by doing a regular checkup of your blood, and maintain ideal body weight, stay away from tobacco. If you just do these three things, I'm telling you, that's the best way to prevent as much as possible the heart disease. As far as the cure and going forward, listen, good habits always help. But if somebody believes that they can escape taking medicine or escape taking modern methods of treating blockages, treating whatever the issue with the heart is just with diet after the disease has already taken place, then they are doing a disservice to their body too. You got to embrace the modern medicine after it has progressed, because now we don't know anything that technically will reverse it all the way without the help from the modern medicine that we have. So I would strongly recommend people, let's just not get there by doing all these preventive measures that you've been proposing, you and I have been talking about. And then if we end up for whatever reason on the other side of the carpet, let us make use of the modern medicine that's available to us.
Yeah, and please excuse me if I inferred or intimated that hinted that I was suggesting that people could avoid, should avoid conventional or modern approaches and only try and reverse heart disease using diet. I definitely do not believe that, and I don't believe the science supports that. But the studies are intriguing to me as part of a holistic approach, and we're talking about holistic approaches today. The how powerful diet can be, even if somebody does have diagnosed atherosclerosis.
100% agreed, and you are 100% correct. With modern medicine, you still can't give up the diet that you were supposed to be on. So everything has to be simultaneous, each one will feed on each other, and ultimately will get better.
Well, and I think that's part of the challenge and the problem that I see with some people, and they've even told me this, that they're going to eat what they want, they're going to not exercise, and they'll just take a pill. I mean, they'll just, there'll be a pill for it, and they'll treat it when it's a problem.
It doesn't work that way.
No, I think that's a recipe for dying young and living your life later years in a lot of pain and disability, and which is unfortunate. I don't think anybody really wants that.
True, true.
With stress management, is there anything that you find to be particularly helpful? I mean, meditation is what's discussed and often in holistic circles and integrative medicine. It frequently comes up. So, in addition to that, are there other things besides that? Because I feel like that topic has been talked about a lot that you find particularly helpful.
Sure. I think the other advice I give to my patients, I'm primarily an Excel guy from Microsoft. So
Mm-hmm.
I tell them that the best way to avoid stress is you write down the issues that you're facing every morning. Then you write down what is the worst that could happen from those issues. And then you write down what you will do if the worst thing happens. And if you, and mind you, I have used the word write down 3 times already. It's, everybody has whatever I'm saying, everybody has that in their head, but it's not written down. The difference between in the head and writing down is reduction of stress. Because if it is only in your head, it just percolates, it just circulates, it just makes you more confused. And ultimately, when it circulates so much that it becomes a ball, and then it's just like the snowball, it just becomes bigger, 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 and then ultimately it explodes. But if you write it down, there's no place to go. It exactly tells you what is the worst that could happen and what are you going to do about it. You can't keep thinking about the same thing if it's written down. So just to supplement what you just said, besides meditation, besides um, other things that we can talk about, writing down your problems, finding out what the worst could happen and what you will do in those circumstances will reduce your stress.
And
And
I've heard that as a good approach as well. If people are stressed, having a hard time sleeping at night because they've got a
absolutely.
lot on their mind.
Yeah, absolutely. Because it just a snowball effect, right? It just
Yeah.
just keeps doing it. The next thing I would recommend, and that's one of the things, is the 3 pillars of what I propose. As you can see on my Life RX program, you will see that I believed that the ultimate goal of life is happiness, and you can derive that by managing your health, managing your wealth, and managing your relationship. And these are the things that causes stress. So if you manage your health properly and not have addiction, if you manage your wealth, and the definition of wealth, everybody should understand, is learn to live within your means and work hard to increase your means. And then definition of relationship is keeping people happy who can make you permanently unhappy. If you do those three things, that also will help you significantly in reduction in stress.
And so tell me about the Life RX program, because I think your approach is really unique in teaching people beyond simply, the habits that we've already been talking about in terms of diet, lifestyle, exercise, stress reduction, those sorts of things. You've taken that and you've understood that, there are other influences in people's lives that intersect to impact their health and happiness and stress levels. So talk about the Life RX program, because I'm really intrigued by that.
Well, thank you. Thank you for asking. It's a extension. We used to call it Life is a Business program, and now we are given a new name called Life RX program. And the website just went live last week. We are coming out with programs on it. There is a quiz for how happy you are, and it's the first time somebody has tried to quantitatively measure happiness, and I've tried that. So we give you a scale on a 0 to 10, what is your level of happiness, by asking you certain questions. We also have a quiz on there which also says, are you an entrepreneur or not? And there is also a quiz for that. So we are trying to quantify all these things, and that's we call it Life RX program.
And then based on that information in the form, what do people what happens?
Based on the information, it's divided into three pillars: health, wealth, and relationships. And we will give proper advice. We'll hook them up with the proper mentors for all those three areas. If your health is in trouble, you will find good doctors for you. We'll give you some advice. If you have a wealth issue, we'll figure out what is the best way for you to manage your finances or make more money, or how to manage that whole entire situation to be happy again. And relationship is to, if you have a difficult situation in your relationships, will guide you through that, how to create the less and less of expectations on relations, and how to create a barrier where they can't make you unhappy. So it's a very comprehensive program that we are embarking on.
I love that. And that just launched recently. By the time
Yes,
this is published, it will have been this episode's
yes.
released, it will have been out a couple of months. And people can find that where can they go to find that
It
website?
will be, I will send you all the information about it, but it's liferx.com.
LifeRx.com. We'll link to that in the show notes
Yes, yes.
below. Is there anything else that you would love to talk about that we didn't mention? I think that you've provided a wealth of information, and definitely the Life RX program is something that everybody should go look at and investigate, because it may help them finally, achieve their goals. A lot of people start and stop with their health, and I think that having a holistic approach like you have created that addresses the different categories of health in their life, relationships, wealth, physical, mental health, all of that is how they achieve total health when those three are pursued together.
No, no, you have covered everything. The only thing I have not covered, and I would like to leave before we leave, is I congratulate you for your efforts. I congratulate you for what you are doing. I'm very impressed for a short time I spent with you. Looks like you are really addressing the need for the society. And please count us as your partners, and please, our good wishes will always be with you for your ongoing success.
Thank you. That's very kind of you. And the feeling is mutual. It's obvious just from the short time we spent together that we are very aligned in our goals to help people and to provide our unique perspectives and approaches. And that's what it takes. I think it takes different approaches are going to resonate with different people, and different people have different needs at different times in their lives. And the more good people that can come together to solve these problems and provide, products and services the more we are going to address the fundamental needs of our society to reduce the scourge of early mortality and disability and the incredible burden that it has financially on our healthcare system and on people's lives and communities. So thank you for the work that you're doing. I'm really impressed and really appreciate learning about it.
Thank you very much, and I'll look you up in San Diego next time.
I'll look forward to it. Yep, sounds good.
Okay. Bye-bye.